Hi everyone, it's Practical Mommy with MyMommyManual.com, and I am here with Dr. Colleen Stratton, who is a chiropractor that specializes in the care of infants, babies, children, and expectant moms. And she was telling me that in her practice she sees a lot of C-section babies for a variety of different issues. Tell me what issues those are.
Well, people don't really realize that babies that are born cesarean can have issues. The main issues that we see are breathing issues and latch issues. They don't breastfeed well, and the same issues as far as forcible vaginal delivery can occur with a cesarean.
So what happens in like a vaginal birth that's not happening in a C-section that it kind of promotes just this healthy, normal development?
Well, obviously, in a vaginal birth, the baby comes through the birth canal, and that pressure molds the cranium, which allows for the cranium to then expand and start the whole CSF flow and get the neurological system working. But it also compresses the lungs so that the fluid that's within the lungs actually comes out. We don't have that in a cesarean birth, and so the babies can then have trouble breathing once they're born.
You mentioned CF something.
Oh, cerebral spinal fluid.
Okay, thank you.
Sorry.
She's such an expert that,
No.
I don't know. So how can you care for these babies and kind of get them back on track?
Well, we do a lot of cranial work and upper cervical work with these cesarean babies. We always check them full spine, make sure that there's nothing in the thoracic spine. And that's an issue. If the baby was malpositioned and that's why they had a cesarean, that we check the cranium and the spine for those dysfunctions. But what people don't realize also is that in those cesareans, they can actually be forcible cesareans. That the OB can go in and actually pull the baby out by the baby's neck. And that's what happens most of the time. Other than that, there are occasions where they actually use forceps to go in and get the baby and pull the baby out with forceps via cesarean, which most people wouldn't think that would be the way. But the same issues that can happen with a baby born vaginally with forceps can happen with a cesarean.
Right. Well, thank you so much for that information.
No problem. Thank you.